Good morning to all. Myself, Dr.T.Sengottuvel, Professor in the Department of Pharmacology, Prime College of Pharmacy, Palakkad. Today, I am going to discuss about drugs used in the treatment of bronchial asthma. Regarding this asthma, the common chronic airway disorder is called as an asthma. It is maybe an allergic conditions or environmental factors. This altogether the condition in which they are recurrent, and also it is reversible obstruction of the airflow. The airway is their response to stimuli which does not affect non-asthmatic subject. What is meant by stimulus? The infections like as a cold air or inhaled allergics or smoke or emotion, sometimes it may be a stress. They categorized depending upon their severity of asthma, that will be an mild, intermediate, and also the mild present and moderate persistence, and also the severe. The airway resistance increased to difficulty in the breathing, and also the symptoms like as a wheezing, cough, and also the decrease the airflow in the lungs. This is maybe a reason for these asthmatic conditions. How will you solve this? They are mainly used for the management of asthma. How will you manage the asthma? First thing, we will use the various class of the drugs. It will be act on the bronchitis. It will be an first class of the drugs will be an bronchodilators, that will be classified again sympathomimetic and also the methylxanthines and also the anticholinergics, then followed by anti-inflammatory agents, then mast cell stabilizing agents, then leukotrienes modifiers. These are the various class of the drugs mainly we are used for the management of asthma. You should know that we cannot cure, we can able to manage the asthma. That's why the classification itself they are mentioned in the management of asthma. First thing, they are sympathomimetics. They are again subdivided into two. They are selective beta 2 agonist. You all know that they are beta 2 adrenergic receptors are presenting in the smooth muscles, especially in the lungs. That will be beta 2. That will be what are the drugs mainly used for in that salbutamol, terbutaline, solmetrol, and also formoterol. Some non-selective agents also, it may be an alpha or beta, it may be act on the both things. That will be an adrenaline, isoprenaline, and also the epitrine. Coming under the naturally available that bronchodilators like as a methylxanthines, that will be an theophylline and also the aminophylline. Then anticholinergic or epitamine and also the followed by the next categories of the drugs will be mainly used for this management of asthma. The anti-inflammatory agents, they are corticosteroids mainly used for the anti-inflammatory properties. That will be based upon the route of administration, systemic and also the inhalations. Systemics are hydrocorticosteroid, prednisolone, methylprednisolons. Then the inhalations like as a beclomethasone, budesonide, and also the fluticasone. These and all used for the anti-inflammatory agents. Then next class of the drugs, that will be an mast cell stabilizer, that will be an sodium chromohydrate and also the nitroconmylin and also the ketofin. Then fourth class of the drugs mainly used for the leukotriene modifiers. Leukotriene modifiers are mainly focused with the leukotriene receptors antagonist. Antagonist in the sense you all know that it will be given the same that of leukotriene receptors. That will be an montelukast, gefrelukast, and also the pranulukast and also the genolukast. If you are coming to this, the same leukotriene modifiers are 5 lipoxygenase inhibitors like as a xylitol. These and all other categories used for this mainly for the asthma. What are the symptoms we are going to know. It will be an first thing, the sympathomimetic actions, it will be modifier. Based upon that, first class of the drugs, sympathomimetic agents. The mechanism of actions, it will stimulate the beta 2 receptors through the bronchitis. It will increase the cyclic AMP actions. It will be at last leads to bronchodilation. If you are coming to the non-selective agents are really used for this because of it will be a side effects and also the low efficacy and also the availability of better drugs. If a short acting selective beta 2 agonist, that will be a rapid onset of actions within the 10 minutes it will be, then powerful bronchodilators last for the 6 hours the actions will be there. Then various route of administrations for this bronchial asthma, mainly for the inhalations, that will be an aerosols, powder and also the nebulizer used for the treatment of this asthma, and also we are given for the orally acting drugs and also the intravenous agents. The actions and use are acute bronchial asthma, chronic asthma, and to prevent the premature labor. These and all the sympathomimetic mechanism of actions and also the use of the drugs. If you are coming to the long acting beta 2 agonist, that will be a slow onset of actions, but it will be act on the long durations of the action. It needed to 12 hours. Use it to prevent the asthma and also it will excrease the including of the asthma. Adverse effect of that will be thromos and also the palpitations. These are the side effects may be given for this long acting beta 2 agonist. If you are coming to the next class of the drugs mechanism of actions, that will be an methylxanthines. That mechanism it will be an, it also will be act on the bronchodilation only. It will inhibit the phosphodiesterase. Okay, the phosphodiesterase is the components to stimulate the bronchodilations. It will be a small difference between the therapeutic and also the toxic dose. Then coming to the theophylline, it will be purely water soluble. Cannot given by the injection. It's given by only oral. Then aminophylline, these are all also the same that of actions of these methylxanthine actions. Thank you.